Welcome to Real Clear Radio Hour, brought to you by the Competitive Enterprise Institute. I'm your host, Bill Frezza. This week, it's back to healthcare, looking at what's broken and how to fix it. In the second half of our show, we'll talk to Heather Higgins, CEO of Independent Women's Voice, about strategies that could lead to a post-Obama repeal of Obamacare. Up first, Paul Ketchel, CEO of MD-Save, describes his company's efforts to rationalize the cash medical services economy rapidly growing in the shadow of Obamacare's enormous deductibles. Paul, welcome to the show.
Bill, thanks for having me.
Paul, your healthcare company, MD-Save, seems to be off the launch pad. You landed $14 million in venture capital funding this spring. What motivated you to enter such a highly regulated and largely dysfunctional market?
Well, in my past, I'd actually worked on Capitol Hill in health policy. I was a federal healthcare lobbyist, and when the first drafts of the Affordable Care Act started to circulate, we looked at them closely and believed that when you looked at a lot of the mandated coverage requirements, that we'd see premiums increase, and as a result, a lot of people go on a high deductible health plan and be paying out of pocket. And at the time, there really wasn't any way for people to shop, compare, or purchase healthcare services in a meaningful manner that are clear. And so the whole mission from MD-Save was to provide a marketplace that allowed people to do exactly that.
So Obamacare, in a strange way, created a cash market that almost didn't exist before.
Yeah, I would say that, this business couldn't have existed 5 years ago. What's happening is, you're seeing, even though you have more people who are covered today, potentially, the majority of them are covered with much higher out-of-pocket expenses. And so now you have Americans who are essentially paying cash for a vast majority of their health care. And so those consumers really need some way to know what the price of things are, since they're going to be paying for them for the first time.
What is a typical deductible for a bronze, I think it's called a bronze healthcare plan?
It's about $6,500.
And that's real money.
Yeah, it's significant. And when you look at the deductible limits that are set, that are out there, one of the things you're seeing is that the majority of people will never hit that deductible in a year. In fact, most of them only hit the deductible when they have an inpatient hospital event. And when you take out pregnancy and you take out Medicare, Medicaid age, or I should say Medicare age, what you're going to see is that people typically only have that inpatient event once every 17 years. So the rest of the time, think of it as those individuals are really paying cash for their health care.
And, even if they're purchasing their Obamacare coverage out of pocket, or if they're getting subsidies, that money is going to the insurance companies, and they're really not getting anything for it.
That's right. I mean, if you have a subsidy or you have one of those plans, the advantage is you're insuring yourself against the car accident or the catastrophic event where you end up in the hospital and you're there for a long period of time. And the coverage is really good for that because maybe you're not going to have bankruptcy like you would have before. The problem is, though, on everyday health care, the preventative things, going to the doctor, you're going to be paying for that. And so it's really almost like not having coverage at all on the, day-to-day health care.
Well, people have been arguing in favor of catastrophic health care only for a long time. But if you tried to sell a catastrophic health care policy, it would be illegal if it didn't include all the mandates. Is that correct?
That's right. I mean, a lot of the plans that were out there offered catastrophic coverage before Obamacare went into effect because, a lot of individuals who just simply couldn't afford the premiums of a regular plan but wanted to insure themselves against the catastrophic. Now you have to have, as an insurer, you have to follow these mandated coverage requirements, and so now those policies are outlawed. And as a result of that, you're seeing premiums increase for many of those individuals who before could afford a policy. They may not be able to afford a policy now because of the premiums without going to an extremely high deductible.
As dysfunctional as this is, it has created an opportunity for MD-Save. Your website states that MD-Save provides healthcare systems a bridge to transparency without jeopardizing their managed care contracts. What the heck does that mean?
Yeah, that's another problem that has, in my opinion, crippled the healthcare system forever. So if you are a healthcare provider and you are taking health insurance, which the vast majority are in order to survive, in many of those contracts, there are stipulations that the individual cannot charge less cannot offer a rate that's less than what their managed care rates are to anyone. The nuance, though, is that those managed care rates are the charge rates. And the charge rates are not what the managed care companies are actually paying the doctor. So what's happening is you might have a charge rate of, say, $2,500 for an MRI, but what the insurance is actually paying the healthcare provider is maybe $400 for that MRI after all the paperwork goes back and forth. But the provider is still not allowed to charge less than that listed rate of $2,500 to an individual who's out of pocket. So what's happened is the high deductible patients are getting hit disproportionately harder by these changes. What we allow them to do is their contracts do say you can charge less than this rate if it's contracted. The contracted rate is their exact phrase. So what happens for us is the providers sign a contract with MD Save. These are MD Save's rates. They're not giving individual patient discounts. So what happens is because of that, they're able to offer a rate that's maybe a little bit higher than what they're being reimbursed from the insurance, but much lower than that charge rate they've been forced to charge. So it makes the healthcare affordable for the out-of-pocket individual, but at the same time, they're not jeopardizing those managed care agreements.
So if I'm a cash patient, it's illegal for me to negotiate directly with a doctor, but if I use a middleman, then I can do it.
Yeah, that's exactly right. It may not be illegal for you as the cash pay patient to negotiate, but the provider is not supposed to give you, he has a floor set in the contract that he's not supposed to go below.
Well, when it comes to dental care, I've been a cash patient for years, and I've always negotiated prices with my dentist. I get him to give me a quote, and I call the dentist across the street looking for a better deal, and I go back and forth till I get the price I want. How did our culture come to believe that negotiating price with doctors and dentists is somehow boorish or vulgar?
It's something we talk about all the time in the company, because if you look at healthcare, here it is, the largest sector of our economy. Everyone's using it. And it's almost like there's a mass psychosis that's come over the United States in the sense that when you buy a major healthcare procedure, it's like buying a car.
Right.
And the difference is you go buy a car, because it's about the same amount of cost to the individual. The difference is that the car lot, they give you the keys. They say, well, I hope you like this car. Drive it home. We'll call you in 6 months and tell you how much the car was. And, that's really what buying healthcare is like right now in America. And for some reason, the American public has been so conditioned to think that, oh, I'm not supposed to know what my healthcare costs. I'm just supposed to sign this because the doctor said so and go home. And, the cost of these procedures could be catastrophic to someone who is on a limited income. And so that's really what, MD Save was all about, is we said, look, let's just let people shop, compare, and purchase healthcare the same way they've become accustomed to purchasing everything else. We'll bring free market forces to work. And as a result, if you bring the free market in, you will lower costs if you make it easy for consumers and providers to transact healthcare.
Well, upfront pricing is a bit of an anomaly in the healthcare business. How have the doctors reacted to that? I go to your website and it lists prices.
Well, that was a big challenge early on. So we have some patented technology that we developed that helped us bundle healthcare services, then do price analysis and compare. But one of the first barriers we had when we entered the market was we would go to a provider. Provider would say, hey, great, I got a ton of patients right now that can't afford what I'm offering them. I want to sign up. And then their next question would be, what should I charge?
They'd ask you.
They'd ask us. And it's still common, even with major health systems. And what we're finding is that you might have a provider who's been doing these same 20 services for 15, 20 years, and the provider has no idea what the cost of the service is, what they net on the service, or how much a patient typically has to pay.
So this whole thing has become an Alice in Wonderland when it comes to costs and prices.
Yeah, in our opinion, this is where the Affordable Care Act really failed, is that when you look at the cost of healthcare across the country right now, the average fluctuation of price for a typical procedure is 770% nationwide. In the local markets, it's over 300%. Good
Lord.
Say, Doctor, and what's happening is you have a bill that's called the Affordable Care Act, or a law, we should say today, but one of the goals was to lower cost, but the problem is you can't really lower cost until somebody knows what the cost is to start out with. And so that was really the first big barrier. And there was nothing in the entire Affordable Care Act that stated what does anything cost.
Well, plus you destroy the entire virtuous cycle of incentives that get providers to actually change their procedures to reduce costs.
Right. Essentially, we do not have a free market system historically operating in this sector, which is why when you hear the reports, well, healthcare has risen 10% faster than inflation annually, and you've got these costs. Well, it's because there's nothing in the marketplace governing the cost or the prices of these procedures.
So, Paul, in how many states has MD Save so far signed up providers?
We're currently in 23 states and about 110 markets.
And what are your future growth plans?
Well, as we're starting to grow right now, we're going to add another 10 states in the next 90 days, and we're going to be in over 40 states in the next 6 months. We already have systems contracted and moving into onboarding those states and moving pretty quickly.
Paul, before the show, I checked the website to get a price quote on a colonoscopy, just for the heck of it. And I found out that there were no providers yet in Boston, but it was cheaper to fly to Florida, spend a weekend at a swanky resort, have a colonoscopy, and fly home for less than the cost of having the procedure done in Boston. Are patients going to figure out that spending a little money on airfare could save them a lot of money on health care?
We do have patients who are doing that every day, and we are coming into the Boston market soon, so hopefully we can remedy that problem. But the short answer is yes. We have patients who are flying all over the country because it's worth getting on a plane for a major procedure if you could save $5,000 to $20,000 in some cases, depending on the procedure. So yes, you are seeing people fly. We're now starting to work with employers that are self-insured, and they're going to be sending some of their employees away with maybe their wife for the weekend to get something done because it's still less expensive than having it done in their initial market.
Well, the Canadians have been using medical tourism as an escape valve for years. They fly off to India to have their hips replaced rather than wait 5 years on a waiting list. Is that sort of medical tourism likely to increase as the years go by?
I think absolutely. I mean, one, you're seeing if you're paying out of pocket and you need a procedure, and maybe it's something that's not even covered under Obamacare, like maybe it's gastric bypass, and you could save $10,000, $12,000, have it done by a well-known surgeon, it's absolutely worth flying for. So you're seeing that. But also, when you brought up Canada, we have systems in Las Vegas that we're launching right now, and one of the things they're going to do is target Canadians coming in also. So we're going to start to service some of that Canadian medical tourism community too.
I might not be too eager to fly down to Florida with no name provider, but have you gotten any headline providers like the Mayo Clinic to sign up? I mean, a brand like that would attract a lot of people.
Yes. I mean, when you look at what we're doing, one of the things we did early on is we contract only really with major healthcare systems. And part of the reason for that is they own a lot of doctors. They're in several markets, but also they do a very good job of policing their own quality. And so, some of the largest healthcare corporations in the company are now customers of ours, or in the country, I should say, are customers of ours, and we're moving forward. So, I do think that the Mayo Clinic, Cleveland Clinic, and groups like that, they're going to follow also because this really is a wave of the future. And when you look at the sector of patients who are going to be out of pocket, either because of the deductible or limited coverage, it's about a third of the United States. So this is quickly becoming the largest insured group in the United States. And so this is going to become a standard way of operating in our view in the near future.
Do you have any offshore providers? I know there are providers in the Cayman Islands or Bermuda or other places that are offering services that are not yet FDA approved. Would you include some of them?
We really haven't discussed that yet. I mean, right now the universe is almost so large in what we're doing right now that we're really focusing on the providers that are here, the everyday things, the highest volume options. It's something we could definitely do. We are looking at an international expansion.
Yep.
And so maybe it would be offered through one of our international subsidiaries right now. I mean, when you look at the foreign systems that everyone seems to marvel after about, you have nationwide healthcare coverage or government-funded healthcare. For example, in Germany, you have a government system, but 45% of the individuals in the country use private insurance and don't even access the government system.
Really?
In France, it's 60%, and in Great Britain, it's 30%. And so what you essentially have is the wealthier or the upper middle class individuals, anyone who can afford not to have to use the government system does not.
They buy out.
And so we're looking at expanding into all of those countries too with the marketplace because there's obviously a lot of value to their populations too.
When I go to the MD Save website, do I understand it correctly that I actually contract for a specific medical service right on the website?
That's right. So what's unique about MD Save is that there are some other sites out there that provide transparency, but our vision is MD Save. It's really the only site where you can look up information, see transparency data, and take action on that data. And so we're actionable. We're the Expedia of healthcare. So what happens is you'll actually buy that procedure on MD Save. So you'll prepay with a credit card, a PayPal account, or there's a loan program. And because you're prepaying that, our average consumer is saving 40 to 60% over any rate they could negotiate on their own. And so as a result of that, because you're paying up front, we're able to get those providers to give us those rates that normally could not be accessed by a patient.
Because a provider gets paid right away, he doesn't have to wait 6 months to get reimbursed.
That's right. We pay all our providers in 6 days or less versus typical 90 to 180 days from a traditional insurance claim.
And are you going to have feedback like they have on Uber and Yelp in terms of customer reviews?
We have a review system with each provider that's seen there, and the way our system works is after you have had a procedure done in a provider, you'll receive a survey email, and you can review that provider one time for each service you've had done.
That should be interesting. Do you worry at all about liability? If someone gets involved in a medical malpractice suit, could MD Save get dragged in?
Well, I think, we do in our terms and conditions state pretty clearly we're a marketplace. We're not responsible for you and the provider, what may happen. We keep that there. But, as a CEO of a company, in our opinion, if you're worried about being sued in healthcare, you're probably in the wrong business.
Yeah, it's a way of life, isn't it?
Exactly.
I see from the website that you've partnered with lenders that offer installment loans to help pay for out-of-pocket medical expenses. How does that work?
We have a lending partner, and so if you need a procedure and you don't have the cash available, you can apply in a pre-approval that lasts about 30 seconds to see if you can get a loan for that program. It's interest-free first 12 months, and if you can achieve that loan, it's typically funded in the next 48 hours. And so that way you could go in and then pay monthly payments on a particular procedure.
Interest-free for 12 months. How did you get a lender to do that?
Oh, we found a lender who was out there, Prosper Health, who was a partner who, a lot like us, they saw the opportunity that was coming in the space. They realized it and said, we're going to move into the healthcare space because the traditional lenders are really not there. And so over time, they kept refining and developing products that they felt were going to be strong products in the space. And so though they have a lot of, it's interest-free for 12 months, many individuals want to stretch it out longer than 12 months, the vast majority. So they've just developed a set of products that can be used around that sector.
And do they use credit checks and underwriting to either accept or deny credit?
They do. So when you fill it out, there is a credit application. You fill that out. But one of the things we really liked about this particular partner was that their credit score limit goes much lower than traditional lenders. And so we've been able to get more people approved than if we would have used one of the traditional lending groups that were out there.
I noticed that former U.S. Senate Majority Leader Bill Frist, Dr. Bill Frist, just joined your board of directors. What's his role?
He's been really instrumental with us. I mean, in our opinion, Senator Frist is probably the foremost healthcare expert in the United States today. And we've used his knowledge in several cases to help refine products, think about how we're going to approach providers, approach larger systems, how to really design and bundle the packages we're offering and do that in a way where we would see, one, strong market adoption, but also fit the need of what many of the consumers out there see.
Did you need any special regulatory approval to launch MD Save?
It was in the beginning, there was a lot of red tape to run through and look at, but what ended up happening was MD Save was such a dramatically different idea than anything that's been in the healthcare space that there was really no regulation surrounding the product or anything we're doing because we sort of fit in the space. It's just outside of what's typically governed healthcare. So one of our challenges with many systems is their own attorneys are nervous about the program because there's no case law that governs the program. But, we're pretty much a marketplace, not unsimilar to an Amazon or an Expedia or a Kayak. So far, we've been very fortunate that there hasn't been over-regulation in the sector.
And presumably you're HIPAA compliant when it comes to things like patient privacy?
Yes, we are. we're HIPAA and PCI compliant when it comes to the credit card information.
Can you share any growth metrics with us?
Yeah, so the company launched into the marketplace about a year and a half ago. And we started, of course, with one system. And as I mentioned today, we're down about 120 markets. We're in 23 states and growing. But what I think is the most fascinating is since 2015 has starting in January, we are growing on volume and procedural volume over 10 to 15% month over month.
Wow, that's a pretty healthy growth rate.
Yeah, so you're seeing really significant growth. As the word gets out there, there's just such a large market that's needed to be served here for a while. And so there's a lot of pent-up demand among the consumers.
Now, $14 million in investment sounds like a lot of money, but with a scale that you're heading for, I'm sure you're going to need further rounds. How long is that money going to last?
We're not sure that we do need further rounds, and the company is already profitable.
Really?
And we went and raised the $14 million so that we would be able to service expansion in individuals. But we have what I think is different about us than a lot of healthcare companies is that we're based in Nashville, Tennessee, the healthcare capital, but we have an engineering team and office based in San Francisco Bay. And our engineers were people who had built large consumer internet companies in the past. And so having that type of engineering talent, we have engineered out a lot of the manpower that's typical in a healthcare operation. And so our costs are fairly low. We're able to scale very quickly because of the engineering talent we have driving the product. And so at the current growth rate, we don't really see other rounds in the company, and we're able to expand right now as fast as we choose to without really putting a strain on the company.
As a CEO of a pretty unusual startup, what keeps you up at night?
What keeps you up at night? There's always a few things out there, but, I think for us is we're the first in the space. In every customer sector we start to service, we're innovating with brand new product that didn't exist before. And so the biggest challenge for us is to try to, one of the things we have to do is anytime we have a large healthcare customer, a hospital system, a insurance group, or whoever that is, we're building brand new product to service them, and there's no roadmap to follow. And so for us, it's always ensuring that as we're building those products, we're going down the right path. We're not making a mistake, because if you make a mistake, it might cost you another 4 months of development to fix it. And so it's paying attention to what the customer needs and what the consumer needs, and making sure that we're always being most efficient in those product build-outs.
Well, Paul, we'll keep our eye on you. Thanks so much for coming on the show.
Yeah, thanks for having us.
That was Paul Ketchel, CEO of MD Save, here on Real Clear Radio Hour, brought to you by the Competitive Enterprise Institute. I'm your host, Bill Frezza. You can check out Real Clear Radio on Facebook or follow us on Twitter at Real Clear Frezza. And stop by RealClearMarkets.com, my go-to place for diverse views on political economics. Real Clear Radio Hour is a not-for-profit, donor-supported program. Please stop by RealClearRadio.org and hit the donate button or contact us to become a corporate supporter. Ahead, we'll speak with Heather Higgins, CEO of Independent Women's Voice, about her strategy to prepare for the repeal of Obamacare by avoiding piecemeal reform. Stay tuned.